In our health-focused world, finding good weight loss solutions is crucial. New treatments like GLP-1 medications, including Ozempic, Wegovy, and Mounjaro, are helping many and changing how we approach weight loss. We'll cover how they work, their benefits, possible side effects, and costs, helping you understand them better. Let's explore how GLP-1 medications fit into today's weight loss strategies. In this first segment, we look at how effective GLP-1 treatments are. Two standout medications are Semaglutide, known as Ozempic and Wegovy, and Tirzepatide, or Mounjaro. At the highest dose, Semaglutide helps people lose an average of 15% of their total body weight, while Tirzepatide has shown even more impressive results with a loss of 21% of total body weight. Both are promising options for those looking to manage their weight. In the next segment, we're looking at how GLP-1 medications work. These drugs work in two main ways. First, they act like a natural hormone in our body, helping us feel less hungry. Second, they slow down how fast our stomach empties, making us feel full for longer. So, with GLP-1 medications, we tend to eat less and feel satisfied with smaller meals. Next, we'll talk about how to take GLP-1 medications. Most of these drugs, like Ozempic, Wegovy, and Mounjaro, are taken as self-administered weekly shots. This means fewer doses, making it simpler for patients. But there's also a pill version of semaglutide called Rybelsus, which is taken daily. This is great for those who prefer pills over injections. When starting GLP-1 medications for weight management, patients usually begin with the lowest dose. Initially, the weight loss progress is checked every month. For patients losing a pound or more each week, they stick with that dose. For patients losing weight more slowly, the dose would typically be increased. Once the right dose is found, it can be continued for the long term and the dose no longer needs to be adjusted monthly. And the good news? There's typically no need for routine lab tests before starting the medication. Now, we'll talk about who qualifies for GLP-1 medications. These drugs, first made for type 2 diabetes, are now used for weight loss. If your BMI is 30 or above, you qualify based on BMI alone. If your BMI is 27 or higher, you can also qualify if you have a weight-related condition such as high blood pressure, diabetes, prediabetes, or high cholesterol. Lastly, those who have diabetes can qualify for a GLP-1 as a treatment for diabetes. At this point, we'll talk about who might not be a good fit for these medications. They're not recommended for people with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. Those with stomach issues like gastroparesis or a history of pancreatitis should also be cautious. Always chat with your doctor to see if these drugs are safe for you. Let's talk about possible side effects. GLP-1 medications can sometimes lead to digestive issues like nausea, vomiting, or diarrhea, and you might feel tired or fatigued too. These side effects are usually strongest after your first dose or when the dose goes up. The good news is they typically only last about a day and go away on their own. That's why we often suggest taking the medicine on a Saturday so you can rest at home and not deal with discomfort at work. When using GLP-1 medications, it's important to be aware of potential interactions with other drugs. If you're also taking diabetes medications like insulin or sulfonylureas, there's a risk of low blood sugar, so close monitoring is essential. Additionally, GLP-1s might affect the absorption of certain drugs, like birth control pills, potentially reducing their effectiveness. Always discuss your full medication list with your healthcare provider to address these concerns and ensure your treatments work together safely and effectively. Let's discuss the costs. GLP-1 medications like Semaglutide, Ozempic, Wegovy, or Rybelsus, and Tirzepatide, Mounjaro, can be expensive, sometimes more than $1,000 per month. The good news is that insurance, especially private insurance, often covers most of the cost. To get insurance coverage, your doctor will need to submit a prior authorization to your health insurance company, usually after sending your prescription to the pharmacy. The insurance approval process typically takes about 1 week but can sometimes take longer, up to a few weeks. If you're looking for more affordable options, compounding pharmacies offer custom versions that are often a few $100s per month, shipping included. To find the best option for your budget, talk to your doctor and insurance company. As a side note, another potential issue regarding the accessibility of these medications is that they are extremely popular and are sometimes sold out at pharmacies due to high demand. Research shows that sustaining weight loss through diet and exercise alone without the help of medication is tough. Studies show that most dieters gain back most of the weight they lost within 2 years. But, using GLP-1 medications like Ozempic, Wegovy, or Mounjaro offers a different story. Those who continue to take their GLP-1 medication tend to maintain their weight loss and avoid regaining the pounds. GLP-1 medications provide a helpful tool to break the cycle of yo-yo dieting seen with the usual weight loss methods that use diet and exercise changes alone. This is why it is usually recommended to take GLP-1 medications long-term to maintain the benefits. If you stop taking them, your weight is likely to go back up to where it was before starting the medications. So, it's important to see GLP-1 medications as part of a long-term plan, not a quick fix. Let's talk about the importance of lifestyle changes to go along with the medication. GLP-1 medications help with weight, but they work even better when you make healthy changes to your diet and exercise routine. Relying only on the medicine alone might not give you the best results. Eating well and staying active not only help you lose weight but also make you healthier overall, reducing the risk of health problems. So, think of the medicine as a helpful tool, but the best results come when you use it along with a healthy lifestyle. In this final segment, we will touch briefly on the history of GLP-1 medications. In 2005, the FDA approved the first GLP-1 medication, exenatide, Byetta, for treating type 2 diabetes. More recently, Semaglutide, Wegovy, received FDA approval specifically for weight management. As you can see, GLP-1 medications are not as new as many people believe them to be. Managing your weight can be tough, but GLP-1 medications are a helpful aid in your journey. As we've talked about, they come with real benefits. Keep in mind that while these medications can be useful, making healthy choices in your daily life is just as important. Talk to your doctor, ask questions, and make sure you know all you need to. With the right info and support, you can work toward a healthier, happier you. Thanks for watching and we wish you the best of luck in your journey.